Chapter 3: Injury Emergencies. First, let's talk about bleeding control. Make sure to avoid contact with blood by putting on disposable exam gloves. Remember to control bleeding, place a gauze dressing over the wound. If none is available, use your gloved hand or other cloth material that won't leave pieces in the skin. Apply direct pressure. If the dressing becomes blood-soaked, add more dressing onto the first one and press harder and wider over the wound. Make sure to never remove any dressing that has been already applied to the wound. Up next is a video on bleeding control, followed by a bleeding control scenario.
Skill: bleeding control. Put on gloves and expose the wound. If gloves are not available, improvise a barrier. For example, consider using a plastic bag, plastic wrap, or extra dressings or cloths. If those are not available, have the person apply pressure with his or her hand. Cover the wound with a sterile dressing. Apply direct pressure using the flat part of your fingers or palm of your hand to press on the wound until the bleeding stops. If you do not have a dressing, use your gloved hand. If the bleeding does not stop within 10 minutes, add more dressings on top of the first one and press harder over a wider area. Do not remove a blood-soaked dressing. Instead, add a new dressing over the blood-soaked one. Apply a bandage firmly over the dressing to hold the dressing in place. If the bleeding continues, call 911 if not already done. If severe bleeding from an arm or leg cannot be stopped by direct pressure, consider using a tourniquet. After the bleeding stops, properly dispose of the gloves and wash your hands.
Now let's do a scenario on bleeding control. A knife slipped and sliced into the forearm of a 35-year-old male butcher at a supermarket butcher shop. He is holding a blood-soaked cloth over the injury, and you see blood on the floor and the display case. He said the blood was shooting out of his arm. How would you proceed to provide first aid to this person? Hit pause and discuss. When ready, unpause to move on to the next section. When thinking about dressings, let's remember to use hemostatic dressings. Apply a hemostatic dressing if direct pressure is not effective in controlling the bleeding. And remember to apply a hemostatic dressing in combination with direct pressure followed by a pressure bandage, such as a roller bandage. Now let's watch a video on how to apply a roller bandage on an arm or leg.
Skill: applying a roller bandage on an arm or leg. Use a 2 or 3-inch roller bandage for an arm or a 4-inch bandage for a leg. Start at the narrow part of the arm or leg and wrap upward toward the wider part to make the bandage more secure. Start below and at the edge of the dressing. Make 2 straight anchoring turns with the bandage. Make a series of turns, progressing up the arm or leg. Each turn should overlap the previous wrap. Wrap with crisscross or figure-8 turns to prevent the bandage from slipping downward and becoming loose. Finish with 2 straight turns and secure the bandage. Securing the bandage with adhesive tape is preferred but you could also secure it with the reverse tie method. Another method involves splitting the two ends so that they go in opposite directions around the body part before tying.
Now let's talk about shallow wounds. What do you do when you come across a shallow wound? First, gently wash inside and around the wound with running water and with or without soap. Next, flush with pressurized water. If pressurized water is not available, pouring bottled water or the like would be acceptable. Pat the area dry. If bleeding restarts, apply direct pressure. Then apply a thin layer of antibiotic ointment over the wound. Last, cover the wound with a sterile or clean dressing and bandage. Now, if you're presented with a severe wound, the following steps is what you should do. First, for a wound with a high risk of infection, clean to the best of your ability. Then cover with a sterile or clean dressing, holding it in place by a bandage. Then care for shock if the person goes into shock. Keep the person from getting chilled or overheated. One first aid topic I like to touch base on is nosebleeds. There's a lot of misunderstanding of how to treat a nosebleed, and so I like to go over this to make sure everyone knows the proper way to take care of it. First, if the nose was hit or you suspect a broken nose, have the person sit leaning slightly forward and pinch the nostrils shut for 10 minutes. Once 10 minutes has elapsed, if the bleeding has not stopped, have the person gently blow his or her nose to get rid of ineffective blood clots. Then pinch the nostrils together again for 10 minutes. You can try other methods such as applying an ice pack or spraying decongestant spray in the nostrils to assist with this clotting. If bleeding reoccurs after the additional 10 minutes, seek medical care immediately. Joint injuries. Here's what to do when you're faced with a joint injury. If it's a sprain, most sprains do not require medical care. If recuperation seems long, consult a physician. Make sure to use the RICE procedure. RICE stands for R, rest, I, ice, C, compress, E, elevate. When faced with muscle injuries, here's what you can do. For cramps, try one or more of these methods to try and relax the cramping muscle. 1. Gently stretch the affected muscle. 2. Press gently on the muscle. 3. Apply an ice pack to the muscle area. 4. Drink lightly salted cool water or a commercial sports drink. Make sure to do not give the person salt tablets. For bruises and strains, use the RICE procedure that we just discussed. The next section, we're going to talk about burns. First up, thermal burns. Stop the burning by removing the person from the heat source. Remove clothing and jewelry from the burn area. Do not try to remove stuck clothing. Then seek medical care for the following reasons: burn on the face, neck, hands, feet, or genitalia, breathing difficulties, blistering or broken skin, large area of skin or tissue burned, and all third and large second degree burns. Here's what to do when faced with first-degree burns. First, immerse the burn area in cool or cold water for at least 10 minutes. If possible, provide the person with ibuprofen. Next, have the person drink as much water as possible without becoming nauseous. Next, keep the burned arm or leg raised. Lastly, after the burn has been cooled, apply aloe vera gel. When faced with a second-degree burn, do the following. If the burn is small, follow the steps that we just discussed for first-degree burns, and then, after the burn has been cooled, apply a thin layer of antibacterial ointment. Then cover the burn with a loose, dry, non-stick, sterile, or clean dressing. If the second-degree burn is a large burn, follow the steps as discussed for first-degree burns with the additional following steps. Apply cold, but monitor as it may cause hyperthermia, and make sure to call 911 immediately. Next, let's talk about third-degree burns. Make sure when working with third-degree burns to cover the burn with dry, non-stick, sterile, or clean dressing and call 911 immediately. Lastly, let's talk about blisters. Hot spots, blisters, is a blister that is closed and not very painful. Depending upon availability and the blister's location, apply one of the following. 1. Blistered bandage. 2. Surgical tape. 3. Elastic tape. Then trim around the edges of the tape to prevent it from peeling off. With blisters that are closed and very painful, first clean the blister with an alcohol pad. Then make several small holes with a needle at the base of the blister. Gently press the fluid out. Next, apply paper tape. Then cover paper tape with elastic or adhesive tape. Then trim around the edges of the tape. Lastly, watch for signs of an infection. If an infection occurs, get to the hospital. Lastly, blisters that are very painful and open or torn. First, use scissors to carefully trim off the dead skin. Then, place a blister pad over the raw skin. Cover the blister pad with paper tape. Then cover the paper tape with elastic or adhesive tape and make sure to trim around the edges of the tape. And then, like others, watch for signs of infection, and if an infection occurs, get to the hospital for additional care.